everybody. So, I'm Aphrodite Rose Starfire. Also, I go by Kimberly Kurtz, and I haven't shown this community yet. Part of my training and education and professional life and my skills are in medicine, and I am a physician assistant, and I think probably one of the best ways for you guys to understand the breadth of my skill set and how serious I take my profession, or at least my my position in healing and helping people, and the privilege that it is to have that interaction with somebody, and that level of trust is very important to me. And I was lucky enough to be trained by an excellent surgeon, and he wrote me a fantastic 9-page reference letter that I have used throughout my professional career up until this point. So this was written, so this was my first job right out of grad school, and doing vascular surgery with Dr. John Thomas Mahegan, and he wrote this letter for me about 2 years into us working together. This was like for a promotion within the medical foundation. He wasn't directly responsible for, the salary, the hiring and firing. It was done by a bureaucratic foundation, that by people behind desks that did not work with me or with patients. So anyways, it's a great summation of my skills, and let's get into it. So this was a while ago, but I have used this throughout my professional career. So this was May 1st, 2013. I'm going to edit some names for privacy purposes. So this is to a manager: Dear Mr. C, Miss Kimberly. He called me by my full name, so he liked to abbreviate to KNK. So that's how he's going to refer to me throughout the rest of this letter. So KNK joined the medical foundation in January 2011. Oh, and I also wanted to say I haven't read this in a really long time personally, so if I react to it, it's natural. Okay. KNK joined the medical foundation in January 2011 and now has completed 2 full years of clinical activity in vascular surgery. During this entire time, I have acted as Ms. KNK's supervising physician. KNK came to her first employment as a physician assistant with an outstanding resume and very compelling personal narrative. For my part, I had never worked with a physician assistant before, but as a clinical professor of surgery at Stanford University, I have supervised, taught, and mentored hundreds of surgical residents, interns, and medical students over more than 30 years. It was to be on-the-job training for both of us. I decided early on that the best course was to use the same practices and techniques with KNK that had worked well with surgical residents. As a consequence, after 2 years, KNK has now had much the same training as a senior surgical resident in vascular diseases and surgery. Early on, we established protocols for every aspect of patient care: how to enter a patient's room, introduce ourselves, scrub for surgery, close a wound, establish vascular access, radiation safety procedures, perform history and physicals, and many, many more. KNK is a remarkable person with exceptional qualities. She is extremely intelligent and well educated with honors, and she is also intuitive, thoughtful, sensitive, and kind. Our patients absolutely adore her. She has received literally hundreds of compliments from patients and their families. Where is Kimberly? Is so often asked if she is not in. Sorry. Okay. Sorry about that. Our patients absolutely adore her. She has received literally hundreds of compliments from patients and their family. Whereas Kimberly is often so asked if she is not in sight. Our patients eagerly look forward to seeing her. Her relationship with the nursing staff is remarkable as well. K&K was the first PA at Blank Hospital to function at so many levels: operating room, cath lab, wards, etc. And at first, the nursing staff was unsure as to her job description. I've been the first PA at every job I've had. I've always been the first PA. Nobody's ever heard of the position or understood my role. So, at first, the nursing staff was unsure as to her job description. K&K did a wonderful job of explaining the role of a PA, including her duties and obligations. Now, she has become a great favorite of the nursing staff. I have received dozens of compliments regarding her care, especially from operating room and cath lab personnel. Also, K&K is a gifted teacher. Patient and thoughtful, she explains to patients and their families the natural history of a disease, the medical and surgical alternatives, and does this gently but thoroughly and completely. K&K does not have bad days. She's always prompt, she arrives eager for work, and is anxious to get going. She does not complain, ever, about anything. She is a people person, warm and giving, but at the same time dignified, slightly reserved, and always the consummate professional. The nature of our vascular surgery practice, large volume, complex, and tertiary, means that K&K has been involved in many different situations calling for maturity, judgment, and finesse. It is quite notable that K&K has received not a single complaint by anybody about anything ever. K&K's experience over these last 2 years involved multiple locations and job descriptions in the office. K&K has become very skilled in obtaining an accurate and complete history of the patient's present illness and past medical and surgical problems. She has become extremely adept at performing a physical examination, especially the highly specialized vascular examination. She is adept at using and evaluating the bedside Doppler examination. She can present a verbal summary of the important components of the history of physical succinctly and accurately, and then propose a diagnostic and treatment plan which is the equivalent of a senior surgical resident. She has performed over 200 history and physicals, and her dictations are of the highest quality. In the vascular ultrasound lab, K&K is very familiar with the use of the ultrasound studies, their indications, and their clinical interpretation. She is working very closely with Dr. H to establish protocols in our vascular laboratory for intervention in venous diseases. In the wound clinic, for the last 2 years, K&K has spent several hours weekly in the wound care clinic with myself as the supervising physician. She is adept at the differential diagnosis of a non-healing wound and creating diagnostic and therapeutic plans. She is familiar with the indications and complications of hyperbaric oxygen treatment, and she has surgical debris to dozens of wounds. She is a great favorite of our wound clinic's devoted nursing staff. The Vein Rejuvenation Program Outpatient Surgery. K&K has been appointed clinical director of our new program under Dr. H's direction. As such, she is responsible for patient recruitment, education, advertising, administration, equipment, and quality assurance. On being on call. K&K has adopted the same practice as myself regarding being on call. She keeps herself available by cell phone at all times, except when actually on vacation or out of town. This means that during the last 2 years, she has been on call almost 700 days. On the hospital wards, the average census of her vascular service is 15 patients, and every patient, of course, is seen daily. K&K is adept at gathering information, summarizing what is important, creating treatment plans, conducting family and patient education sessions, and communicating with the nursing staff, pharmacy, and physical therapy consultants. She communicates well with our physician colleagues, and I have received many compliments about her professionalism. K&K's basic science knowledge is exceptional, as is her understanding of anatomy, physiology, and epidemiology. She is an expert at interpretation of our laboratory studies, x-rays, CT scans, and CT angiograms. K&K's memory is often astonishing. In the cath lab, K&K has assisted me in the cath lab on many dozens of cases. In every case, she now performs a significant portion of the procedure under my personal supervision. She has a thorough knowledge of the indications for interventions, anatomy, techniques, complications, and rescue strategies. She has performed many dozens of arterial and venous percutaneous needle placements with ultrasound guidance and with installation of sheaths. Fluoroscopic placement of catheters, balloon angioplasty, application of arterial venous stents, and thrombolyses have all been done by K&K many times, and she has now reached a level of expertise that she is ready in many cases to perform these procedures independently, without direction of physician supervision. This is especially the case in procedure regarding dialysis access. K&K understands the team approach so important in the cath lab, and she works seamlessly with the radiology technician and nursing staff. In the operating room, just as was my practice with training surgical residents, K&K, when assisting me in surgery, always performs at least some of the procedure. The best surgical assistant, in my opinion, is such because of first-hand knowledge of how surgery is actually performed. In other words, the best surgical assistant is a very good surgeon. K&K has gradually performed more and more of each operation as time has gone by. She has quickly mastered positioning the patient, surgical preparation, draping, and local regional anesthesia and exposure for the surgeon, as well as knot tying, cautery, dissection, wound closure, and arterial and venous anastomoses. She takes justifiable pride in the aesthetic quality of her skin closures. She does not get tired, is always cheerful, never complains, and is a great help to an inexperienced scrub nurse. K&K loves to operate, and it shows. She has great hands, a delicate touch, and perfect instincts. K&K has first assisted on more than 400 cases over the last 2 years in the cath lab and in the operating room. She is one of the very best first assistants I have ever had the pleasure of working with. Dr. Mahegan was in his early 70s at this time, and had been trained at UCSF, and he used to tell me stories of, he'd tell his war stories in the operating room, and he was a doctor before CPR was invented. He'd be like, back when I was a doctor before CPR was invented. I'm like, wait, what? You were a doctor before they invented CPR. Okay.